Hello, my name is Julie Zeller. This is my presentation, Improvements to the User Experience of Electronic Health Records. Statement: Electronic health records are an integral part of healthcare and how patients access their medical records. Naturally, there are barriers to overcome in the accessibility and usability that can improve patient satisfaction in the user experience. An improved electronic health record can be obtained by involving stakeholders in implementing user-friendly features to overall improve patient satisfaction and safety in the electronic health record experience. Objectives. After listening to this presentation, viewers will be able to define the user experience, identify pros and cons of the user experience, identify the necessity to include stakeholders, and identify appropriate improvements to improve the user experience. User experience. Before diving into this presentation, it's important to understand a few terms. The Oxford Dictionary defines user experience as the overall experience of a person using a product such as a website or computer application, especially in terms of how easy or pleasing it is to use. According to our textbook, Healthcare Informatics by Nelson and Staggers defines user experience as a term that explains a person's interactions and perceptions from using a product, system, or service. The definition, according to healthit.gov, an electronic health record is a digital version of a patient's paper chart. Electronic health records are real-time, patient-centered records that make information available instantly and securely to authorized users. To put this into perspective, the most common type of electronic health record is MyChart. Patients can access lab results, schedule appointments, message with providers, and see their medication lists, among many other features within this application. Challenges. Now that we understand those important terms, let's look at the challenges of electronic health records. Because technology is not perfect, very often software and equipment malfunction. They require routine maintenances and software updates, which can cause downtimes when patients will be unable to access their information. Another challenge is alert fatigue. Very often, applications like MyChart have several types of alerts that can become annoying to users, ultimately being ignored. Another challenge is data entry errors. Providers inputting the data into the electronic health record can very often make a mistake, whether it's documenting into the wrong patient's chart, including wrong information, or typographical errors. Interoperability is another challenge we see with electronic health records. According to the American Medical Association, communication of information in an electronic health record may be hindered because interoperability is inadequate within components of the same electronic health record or from the electronic health record to other systems. In one case, clinicians couldn't access labs from a patient's record held in a different hospital. Last, patients who have little experience with the internet or navigating applications will have difficulty using electronic health records. This is very common in the older adult population. Effects of improved electronic health record. If the challenges in the previous slide are addressed, then the effects of improving the user experience of electronic health records will result in increased patient satisfaction, increased patient safety, and a reduction in errors. Patients will be more confident in the ability to use electronic health records, overall improving the user experience. Steps to improve user experience. The steps involved to improving user experience are engaging stakeholders for support and promotion, redesigning the applications to be more user-friendly for all generations, creating the opportunity for interoperability between different health systems, and patient safety. Effects of involving stakeholders. Involving stakeholders in improving user experience of electronic health records will help determine clinical effects and improve patient privacy. Stakeholders will have the ability to conduct interviews and perform user tests and eventually leading to the adoption of a new, improved system. Conclusion. Improving the user experience to electronic health records ultimately improves patient satisfaction and safety. This can be accomplished by involving stakeholders, implementing user-friendly features, and allowing for interoperability.